Good morning, everyone. I am Llyara Dwayne Galdones from BSN 3B, and today I will be discussing about Raynaud's disease. Raynaud's disease. Raynaud's disease, also called Raynaud's phenomenon or Raynaud's syndrome, is a condition that affects blood flow to certain body parts, usually fingers and toes, causing them to feel numb or cold due to stress or cold temperatures. So it happens when blood vessels narrow in response to triggers like stress or cold, reducing blood circulation temporarily. So pathophysiology. The reason that this happens is due to vasoconstrictions and spasms of blood vessels in these areas, meaning the blood vessels get narrow and therefore reduce the blood flow to these regions. In Raynaud's phenomenon, these spasms happen in response to cold, stress, and emotional upset. The appearance of Raynaud's phenomenon in action affecting the fingers. First, you will see a very pale appearance of the fingertips. It then transitions into blueness and then red appearance of the fingers. Primary Raynaud's phenomenon can occur on its own without any other underlying medical conditions. However, if Raynaud's phenomenon is occurring due to another disease, which is possible, it's known as secondary Raynaud's. So the mechanism of how it happens is the body extremities are exposed to trigger factor, most commonly being cold weather. There is spasms of the small arteries at the fingers and toes. These regions become pale due to reduced blood flow and low oxygen supply. The affected areas then often can turn blue in color due to lack of oxygen and tissue hypoxia. After warming up, the arteries dilate, which increases blood flow and there is increased oxygen supply. The color of the extremities then change to red color, and here usually have warmness at the extremities and throbbing pain. There is also maybe some slight swelling. Usually, when this process happens, it usually bilateral, meaning it happens on both left and right hand. Raynaud's phenomenon is more common in women than men, at a ratio of 5:1, and often more frequently occurs during periods of cold weather. The complications of Raynaud's could be serious as it may lead to gangrene and amputation. But this is extremely rare unless exposure is severe and prolonged, or if there are other medical conditions present where there is blockage of your arteries. So to diagnose Raynaud's, physical examination of arteries are conducted along with ANA tests to test for any autoimmune disorders. Thermography and arteriography are imaging studies which could be undertaken. The initial management of Raynaud's is to teach the patient to avoid certain stimuli like cold temperatures, as it provokes vasoconstriction as the extremities. Tobacco is also a stimuli for Raynaud's, as it also causes vasoconstrictions at the extremities. As Raynaud's causes throbbing pain, painkillers are advised. In terms of medication, calcium channel blockers like nifedipine and amlodipine can be effective in reducing symptoms. A procedure known as sympathectomy could also be undertaken, which interrupts the sympathetic nerves by removing the sympathetic nerve. ganglia to reduce incidences of blood vessel spasms. Also, some medications like amphetamines and certain cancer drugs should be avoided as they can cause narrowing of the blood vessels, which may promote symptoms of Raynaud's phenomenon. Next, we have laboratory and diagnostic studies. So, nail-fold capillaroscopy. It examines the tiny blood vessels near nails under a microscope to detect abnormalities in their structure, which can be indicative of Raynaud's or related conditions. Next, blood tests. These tests might include checks for certain antibodies associated with autoimmune diseases. Cold stimulation test. This test involves monitoring the skin reaction to cold temperatures, which can trigger a Raynaud's attack. It happens in observing how blood vessels respond to cold exposure. Next, we have thermal imaging. It captures temperature changes in the affected areas, showing differences in blood flow and temperature between affected and unaffected areas. This can also help visualize blood flow patterns during an attack. So these tests are essential in diagnosing Raynaud's phenomenon or Raynaud's disease, as they help in confirming the condition and ruling out the potential causes for similar symptoms. They aid in understanding the extent of blood vessel involvement and guide the treatment decisions. Medical management. So the primary drug of choice for managing Raynaud's disease is typically calcium channel blockers, such as nifedipine and amlodipine. These medications can help relax and widen blood vessels, improving blood flow and reducing the frequency and severity of Raynaud's attacks. Nursing management. So these nursing interventions aim to empower individuals with Raynaud's disease to manage their condition effectively, minimize the frequency and severity of attacks, and prevent complications. So the first one, we have education and lifestyle guidance. Provide education about Raynaud's disease, including triggers, symptoms, and preventive measures such as avoiding cold temperatures, stress reduction, and wearing warm clothing. Next, monitoring and assessment. Regularly assess the affected areas for changes in color, temperature, and sensation. Document and report any signs of complications like ulcer or tissue damage. Next, medication administration. Administer prescribed medication as directed and educate patients on their use, potential side effects, and expected outcomes. Wound care and prevention. Instruct on proper wound care techniques and preventive measures to avoid injury or infection in affected areas. Support and counseling. Offer emotional support and counseling to help patients cope with the challenges of managing Raynaud's disease. So the last one is the collaboration with healthcare team. Work collaboratively with other healthcare professionals to coordinate care, monitor the effectiveness of treatment, and adjust interventions as needed.